So today we're going to talk to you about the Core Test brand of cannabis drug test kits. These tests, made by Core Diagnostics or Core Technology Company Limited, are a strip test to detect the presence of cannabis and cannabinoid residues in human urine. These tests are available for sale in the UK. Each sachet contains a single test strip. On the reverse of the foil are very easy to follow instructions for the test procedure. The test strip is removed from the foil, dipped into the sample, and the results read between 3 and 8 minutes. Also on this foil, which is a generic foil for test kits, is the demonstration example for a cannabis cassette in this brand and how to interpret the results. So basically there's everything included on how you need to complete a test on the back of these foils, and with the urine sample ready, you're ready to perform a simple cannabis test. So if we remove this test from its foil, you'll see here we have a standard urine test strip for cannabis, THC marked on the handle end to determine the selectivity of the test and what it tests for, a maximum dip line on the urine end of the test strip, and a narrow section in the centre for the results. So if we open the specimen pot, I'm going to dip the test strip to just below the maximum dip line for between 5 and 10 seconds. And you'll see already on that test strip that the centre narrow section of the test strip is starting to show some pink discoloration as the dye moves up towards the handle end. And now what we're doing is just waiting for the test and control lines to show. If you then refer back to the examples of how to interpret the result on the foil, you will see that we're looking for the presence or absence of a control line. Now, confusingly, the control line is shown on these foils in the wrong direction. So to interpret these results, you need to hold the test strip this way, because the control line always forms nearer the handle end to show that urine has been absorbed sufficiently to run the whole test membrane. And you'll see here developing on this sample, if I bring it close to the camera, you've got two clear lines forming. The control line is the line nearest the handle end, and the test line is the line that's forming nearest to the dipped urine end. Now, the absence of a test line would indicate the presence of cannabis over the sensitivity of 50 nanograms. The presence of a test line, which is formed almost immediately as the control line is formed here, is shown that there's no cannabis detected in this sample. This is a negative test result. We're often asked, how long do these tests detect cannabis for after it has been used? The answer for that is on a 50 nanogram test membrane, which is the internationally agreed standard. You can expect to detect cannabis in the urine sample between 3 and 5 days. Now there is that window period that's described in how long they will detect cannabis for, because the obvious unknown quantity is the amount of cannabinoids that have been absorbed. Now, in people that have used cannabis for a long period of time, and we're talking over several months or years, and have used very high concentrated cannabinoids, there will be deposition of the cannabinoid drug in their fat cells, and in those cases, even if they cease using cannabis, they can still leach cannabis and cannabis residues out of their system for anything up to 28 days. And the Home Office has done these tests in the States and in the UK, and they have shown that 28 days is about the absolute physiological maximum period over which cannabis can gradually be excreted from the fat cells and still present in urine. Beyond that, you would not expect in a normal healthy person to detect cannabis in urine if they'd not been exposed to further cannabis. The other question we're often asked is, will I show positive after passive inhalation? If I've been in a room with cannabis users for a long period of time, can I absorb sufficient quantities to show a positive result on a urine drug test? And the answer to that, again from studies, is no. To reach the 50 nanogram in urine concentrations, you really have got to inhale very high doses of cannabis, i.e. you've got to actually use the cannabis, and you will not absorb sufficient cannabis from passive inhalation, even if you have been in closed quarters with other people using cannabis.